Hi, everyone. My name is Natalie DeMace, and I'm here today to go through a presentation on Medicare. So today's designed to be an educational seminar. If you have questions, I have the chat box open and I have people monitoring that. I also have email available to you that you can email your question in for us to answer as it becomes appropriate, as the time becomes appropriate. Let's see here. Something stuck. Give me 1 second. Oh, there we go. So here's the email. If you want to send us an email, you can email benefits@barnumfg.com, and we'll be answering those questions throughout the presentation and also at the end. So getting down to the basics, what is Medicare? Medicare is a program that was designed in the late 1960s to provide health insurance for individuals age 65 and older. Eric, can you confirm that you guys can see my screen? Can someone just chat with me and say that they can see my screen? It looks like it's set up, but I just want to make sure. Yes, it looks like we can see my screen. So again, it's a federal program that was designed in the late 1960s to provide health insurance at an affordable cost to individuals who are over age 65 and those under age 65 if they're on Social Security disability. It's also available to people at any age if they have end-stage renal disease. In order to be eligible for Medicare, you must be considered fully insured, which means you must have worked at least 10 years in a Medicare-covered employment, either through your work history or the history of your spouse. You also must be a citizen or a permanent resident of the United States. When you look at what Medicare is, the government provides us with Medicare Part A and Medicare Part B. A is for hospital services, B is for doctor services. So as soon as you're eligible for Medicare, that's what the government gives you. All the other things are available to you through private insurance companies. So when you have Medicare Part A and Part B, really what happens is you have a choice. Your first choice is to enroll in a supplement plan with a separate Part D or prescription drug plan, or to enroll in what they call a Medicare Advantage plan, a Part C plan. So everyone must have A and B, and then you have the option of a supplement with a D plan or a Medicare Advantage plan. We're going to talk through all the different options here. Let's get back to what the government gives us. The government provides us with Medicare Part A. There's typically no cost for this, provided you've worked and paid into Medicare for those 10 years. There is a cost if you haven't, and that cost can be as high as $505 per month. So the government is giving that to you at no cost. What happens here is that if you only have Medicare Part A and you're hospitalized, you stay overnight in the hospital, you would have a benefit period deductible of $1,632. So that's what you'd be responsible for. Medicare will cover everything else. If you're, excuse me, if you stay there more than 60 days, then there's additional copays. With Medicare Part B, there is a premium associated with the Part B. That premium is based on your tax return from 2 years earlier. So in 2024, they're looking at your 2022 tax return. And I'm going to show you that chart in the middle in a minute, but the standard Part B premium is $174.70. There is a calendar year deductible of $240, and then you'd be responsible for 20% of all expenses after that. Medicare Part B pays for 80%. You would be responsible for the 20% if you do not have any secondary insurance. Also, if you just have Medicare Part A and Part B, there's no out-of-pocket limit. The exposure for you financially could be unlimited. So I mentioned that there's the standard Part B premium. It's based, again, on your tax return. So if you look at your tax return, do you file single? Do you file jointly? Do you file married filing separate returns? Depending on where you are, that's how much you'd pay. So if you look here, if my husband and I, if we make our modified adjusted gross in 2022 was less than $206,000, we pay the standard Part B premium. $174.70. But let's say we made more. Let's say our modified adjusted gross income was $250,000. Based on that, the Part B premium is going to go up to $244.60. Then I'm also going to pay a Part D income-related monthly adjustment of $12.90. So each of us, our Part B premium and the income-related monthly adjustment will be $257.50 per month for each of us. So I always get the question, well, I work, but my spouse doesn't work. Why are we both paying the same amount of money? Well, the reason being is that you file your taxes jointly. So you're following this category. If you do filing separate returns, it might end up even costing you more money by doing it that way. So it's really important you know what the rules are and you take a look at it to see what the impact is going to be. But let's say I was working in 2022, so he's making, our modified adjusted gross income was $250,000, but I'm retiring in May. I'm not going to be working. I'm not going to have that income coming in. There is a form that you can complete. It's called an income-related monthly adjustment event form. That form, you could submit it to Social Security and say, well, I was working and now I'm no longer working. And based on not working, my income will probably be below the $200,000. Please reduce my Part B premium. So I'm finding that as long as you were working and no longer working, that's one of the qualifying events that allow you to have your Part B premium reduced. So it's important to look at it. The other question I get is, well, yeah, I'm still working, but in 23, my income was lower. Every January 1st, the government looks at your tax return from 2 years prior, and that's where they'll calculate your Part B premium. So in 2022, my income was lower, but in 2023, maybe I sold real estate or sold some stock. My income went up a lot higher than the 206. Then for the whole year, I'd be responsible. My spouse and I would be responsible for the higher amounts. Eric, just checking in on any questions, if there's anything coming in. Okay. So the biggest question is, when do you enroll in Medicare Part A and Medicare Part B? It matters your situation. If you're already collecting Social Security, you'll automatically be enrolled in Medicare Part A and Part B, and coverage will be effective the first of the month you turn 65. Unless your birthday happens to be the first of the month, then it's the first of the previous month of the month you turn 65. So let's say I'm not working, I'm collecting Social Security, but I'm covered under my spouse's plan. Well, then when I receive the card in the mail, the A and B card in the mail, I can fill out the back saying, well, I have credible health insurance, so I don't need the Part B. Please cancel my Part B. So that'll cancel my Part B so that I don't have to pay for it any longer. So that's one way of things that happen. Recognize you do want to double check with the employer plan. Some employer plans, especially small employers with 20 or less employees, will require you to have Medicare Part A and B as your primary, and their plan would be secondary. So it's important to understand what those differences are. If I'm turning 65, if I am turning 65 and I'm not collecting Social Security yet because I'm waiting for my full retirement age, but I need health insurance, then the 3 months prior to the month I turned 65, up to 3 months following the month I turned 65, is my initial election period where I can enroll in Medicare Part A and Part B. So I must do something, and it will not happen automatically. I must do something. Third choice is, I'm still working. I'm over 65 years old, and I'm working, or my spouse is still working, and I'm receiving employer medical benefits. Then the rule is within 8 months of leaving employment or losing coverage, whichever is earlier, I must enroll in Medicare Part B. So I just want to repeat this because a lot of people are working longer, but a lot of employers sometimes for their older employees will say, here, we're going to give you a package. If you retire now, we'll pay for your health insurance for 1 year. But remember what happens, what this rule says, within 8 months of leaving employment or losing coverage, whichever is earlier. So you must apply for the Part B within 8 months, even though your employer is paying for that health insurance for a full 12 months, And then you can go back and, you know, apply for a secondary insurance after your health insurance expires. So I have a couple chat messages here, so I just want to get to them. If someone someone terminates during the year that they're eligible for retirement, I think this has to do with the Part B premium. Teresa, if I don't answer this correctly, feel free to chime in and let me know. But if you're working half a year, you did make money that year, but the next year, again, your income is going to be lower than it was in 2022. That's when you would fill out that form saying the income related monthly adjustment. You know, I'm eligible for that. So you would be looking at that. And the next question is, does your IRMA set your Medicare cost for life? That is not valid. So what happens is you get a one-time opportunity. So if I was working, making the 250,000, I apply for Medicare Part A and B, and the next year I'm estimating that my income will be less than 200,000. That would be my rate for the rest of this calendar year. Then January 1st, they're going to look again at my income from 2023. So they look back every 2 years. So if I retired and I expect my income to be lower and I win the lotto, guess what? My income went up quite a bit for that year. For the next, when they look at it 2 years from now, so in 2024, they're going to look at it January 1st of 2026. They're going to look at my 2024 income and say, Natalie won $2 million. Guess what? I will have to pay that higher amount for the entire calendar year until I see my income going down. So if you're still working, if you're over age 65 and you're still working because you like your job, or maybe financially you have to do it, and you have medical insurance at work, again, provided your employer has more than 20 employees, you do not need to enroll in Part A or Part B at this time. I encourage you to enroll in the Part A because it just gives you a Medicare number. It makes things easier, but you do not have to pay for the Part B, which brings up another point. A lot of people think, hey, Part A is free for me. As soon as I turn 65, I want to enroll in Part A. If you are currently contributing to a health savings account, you cannot have Part A and contribute to that health savings account. There's some tax implications of doing that. So again, if you're in a large employer, turning 65 and you're contributing to the HSA, you may want to wait to enroll in the Part A until you're ready to actually retire. So again, the Medicare Part A and the Medicare Part B, that is going to happen automatically if you're collecting Social Security, but that will not happen if I'm working and not collecting Social Security. I will not automatically be enrolled in Part A and or Part B. I'm reading the questions and I'll answer everyone in a second. So the question is, I'm currently married. My income was higher. So if I enroll in Medicare Part B, I'm going to have a higher IRMA. So there are selections on the IRMA form that ask, I just want to check and see. I think there's a divorce is one of them, that your income has gone down because of a divorce, that you'd be able to fill out that IRMA form specifically and take a look at that. Let me just see here. I'm just pulling up the form. I want everyone to have the answer. I can share with you. These are the reasons why you can ask a type of life-changing event. So a marriage, a divorce, a death of a spouse, work stoppage, work reduction if you go part-time, loss of income producing property. And that's not selling a 3-family house. That would be if because of a storm, you lost the potential to earn income from that, loss of pension or employer settlement payment. So they have very specific reasons that allow you to reduce your Part B premium. So someone's asked me, where do you find that form? That form, you can Google it. It's form SSA-44, or if you email me or email the benefits at Barnum FG, we can email that form over to you. So if you're currently working and enrolled and contributing to a health savings account, you cannot have Part A. But if you're enrolled in a flexible spending account, you can. So if you talk through the differences, a flexible spending account, you put money aside on a pre-tax basis, but you must use that money in the same calendar year. You can have Part A and contribute to a flexible spending account. If you are doing a health savings account, then no, you cannot have Part A, or you should not have Part A and also be contributing to a flexible spending account. All right, let's go on with the presentation. So again, it's important to understand the rules, because if you don't enroll when you're supposed to, there's a financial penalty and there can also be a time period penalty. So it's important for you to understand the difference and understand what it is. And this penalty stays with you for the rest of your life. So it's really important that you look at it and make sure that you're doing it at the right time. If you're not sure, call your local Social Security office. Call me. Call someone who knows. Don't ask your brother or your sister or your neighbor or your friend because they've been through it. Every situation is very different. And the timing, especially the closer you are to your 65th birthday, the timing is very sensitive. So you want to make sure you're doing it when you're supposed to be doing it. So we talked about what the government gives you, Medicare Part A and Medicare Part B. And then we talked about there's two options. So we're going to talk about the first option. The first option is enrolling in a Medigap plan or a Medicare supplement plan. With these types of plans, they're designed to pick up some to all of your out-of-pocket exposure, based on which plan you purchase. They are sold by private insurance companies. The government does not sell Medigap or Medicare supplement plans. These plans do allow you to see any Medicare provider anywhere in the country for a Medicare service. So you don't have to say, hey, my doctor already accepts XYZ company. I know they're good. No, you have to make sure they accept Medicare. So it gives you a larger network of doctors to take a look at. You must be enrolled in Medicare Part A and Medicare Part B in order to purchase this. And then you purchase a separate standalone Part D plan. You cannot have a Medicare Advantage plan and a Medigap plan at the same time. So with the supplement plans, they go from the letter A to the letter N. So you have Medicare parts A, B, C, D, then you have supplement plans A through N. These plans are federally regulated, so every plan G has the same coverage at the minimum. They have the same coverage. Every plan N is the same throughout from one company to another. What's really different between one company and another is the price and also the value added discounts and services. So again, we have here the letter A to the letter N. There's lots of plans. It's a pretty convoluted slide. So let's talk through the next one to make it a little easier. So, if you ask your parents, they probably had the Plan F. So older individuals, that was really the only plan available, the Plan F. It's no longer available to people who are turning 65. You had to have turned 65 prior to 2020 in order to be eligible for that plan. So the most comprehensive plan today is this Plan G. When I say comprehensive, it covers all of your Medicare expenses except for the calendar year Part B deductible. And the calendar year Part B deductible this year is $240. So it covers a lot of your expenses. A lot of people don't need that much insurance, so they'll look at a Medicare Plan N. With a Medicare Plan N, the way that works is that in addition to the $240 deductible, you're also responsible for a $20 copayment for a doctor visit. If it's a primary or a specialist, it's a $20 copay. And then if you go to the urgent care center or the emergency room, it's a $50 copayment. These plans also have a provision in there where if a provider wants, they can charge you an excess charge. What does that mean? The doctor charges you $200 when you go to see him. Medicare says you can only charge $100. So on this Plan N, you'd be responsible for a $20 copayment. Then, if the doctor wants, he can charge you an extra 15% of that Medicare approved charge. So an extra $15 on that $100. So for that doctor visit, you'd pay the $20 copay and also the $15 excess charge. Many providers are not charging that today, but it could change in the future. So it's something you should definitely be aware of. Today, a lot of people on their employer plans are accustomed to high deductible plans. So when you look at a high deductible plan, G also has a high deductible plan. So what happens there is the premium's a lot lower, but then you would have copays. You would pay for all Part A and Part B deductibles and coinsurance up to a maximum per calendar year of $2,800. So it might be an option for someone who says, I like the luxury of having access to more doctors, but I don't want to pay the premium because I hardly go to the doctor. This could be an option for you. I got a question come up here. It says, but I don't know where it's coming from. So Rodell, if you want to chime in, raise your hand. I could try to let you in to ask your question. I'm not understanding your question. So what it relates to. I think it's if I'm under six, if you're under six, I think the question is if my wife retires 5 years early. So here he is. Hold on. Can you can you ask your question, Rodell? You could unmute yourself and ask your question. Okay, when you can unmute yourself, we could, I'm happy to answer your question. I'm not understanding your question right now. So when we talk about Medicare, as important it is to discuss what's covered, it's important to understand what's not covered also. So custodial.
Oh, sorry, can you hear me now?
Now I can. Hi.
Hi, sorry. I'm retired, so I asked my wife if she would retire early, and she says yes. My question now is, will she be covered with with mine, Medicare, whatever, or A and B, if I retire? If she retires early.
Yeah, so she has to be 65 years old or be on Social Security disability for 25 months in order to be eligible for A and B.
Okay.
So if she's not 65, she won't be able to be on the same plan with you. You can't have the A and B on the same time. So what would happen is she'd have to find a COBRA or an individual plan to enroll in until she's 65 and eligible for Medicare.
Okay. So what if we get out of the country?
That's a different question. So
I know.
so when you're on Medicare, if you're on Medicare and you leave the country, some people choose to stay on Medicare Part A and B and continue to pay their premium because they're planning on coming back or they think they may come back to the country. So that's a personal decision, and that requires a little bit more one-on-one coaching. So if you'd like to talk to me, I'm happy to talk to you about it. But there are things that you need to be aware of if you leave the country and you cancel your Part B. As far as getting it back, there could be some issues. So we should just have a conversation about it privately.
Okay, appreciate it.
So as far as what Medicare's saying, what Medicare's not covered is, again, personal care. So when we talk about the personal care, that's if someone I had a stroke, I went into the hospital, I'm there for a couple days, and they send me to a skilled nursing facility, and I need help with speech therapy, physical therapy, occupational therapy. As long as I show signs of improvement, I'm getting better, then it's considered skilled care. But as soon as I stop showing any signs of improvement, it turns into custodial or personal care. So while Medicare will pay up to 100 days, please recognize it's 100 skilled days. Medicare or your secondary insurance will not pay for any services from providers who opt out of Medicare. So they must be willing to accept Medicare in order for them to be reimbursed. Massage therapy, cosmetic surgery, that's I think, common sense that it's not covered. Care while traveling outside of the United States. Many plans do have coverage outside of the United States, but they vary what they cover and their limitations. So if that's something you do on a long-term basis, it's important to understand how they work, each one, and how it works for you. As far as vision, Medicare will cover things having to do with retina, glaucoma, your cataracts. They're just not going to pay for your refractions exam, the testing of your eyesight. For dental, it's typically not covered by Medicare in the hearing, but it may be available to you through riders, through the different plans, the different options you're enrolled in. So once you enroll in a supplement plan, you must also enroll in a Medicare Part D plan. Part D is for prescriptions. These plans are designed to lower your prescription drug costs. They are sold by private insurance companies, and it does not have to be the same insurance company that you purchased your supplement with. You must live in the plan service area, and costs will vary based on where you get your prescriptions. Do you get it from one pharmacy to another versus a grocery store pharmacy? So if you have a very specific pharmacy you want to look at, you want to make sure how it's being treated by these different plans. If you're enrolled in a Medicare Part D plan, most Medicare Advantage plans also include a D component to it. And we'll talk about that when we talk about Medicare Advantage plans. And if you don't purchase a drug plan when you're first eligible, there will be a penalty for each month you're late in enrolling. So let me explain that. So a lot of people say, well, I don't take any medication and I don't plan on it. I take herbs and vitamins and I don't need medication. Well, that's great for today, but recognize if you don't take a drug plan and then in the middle of the year you find out, God forbid, that you have cancer and you need a chemotherapy oral medication and you don't have any insurance, you have to wait till January 1st of the following year to be enrolled in a new plan. So you're paying 100% of the cost of that prescription until then. And then when you're do enroll, there's going to be a penalty. So again, even though you don't take any prescriptions, I highly encourage people to enroll in at least a low-cost drug plan. This way you guarantee that insurability and you don't have the discounts. So the question is, if I'm under an employer plan that covers me for my prescriptions, should I also enroll in Part D? No. So if you're covered under your employer plan, you don't have to do anything. You should just stay under your employer plan. A few months before you retire, that's when you would have them fill out paperwork that says you have credit, you've been covered and you've had credible health insurance. At that point, then you can enroll in either your supplement with a drug plan or a Medicare Advantage plan, but you don't want to do it while you're still working. With prescriptions, with Part D plans, so there's a lot of different Part D plans. Each insurance company probably has 3 plans that are available to them. It's important to take a look at your prescriptions that you're taking. All of them have formularies. And depending on where it falls on the formulary, it'll depend on what your cost will be. So typically a tier 1 is a preferred generic. A tier 2 is a non-preferred generic. Tier 3 is a preferred brand, and so on. So the lower the tier, typically the lower the cost of your prescription. Let me show you here. You probably have heard about donut holes and coverage gaps. So if we look at this, once you enroll in a drug plan, even if it's included under your Medicare Advantage plan, there might be an upfront deductible. The most they can charge you this year is $545 for a deductible. And many of the plans only charge you the deductible if you're taking brand name prescriptions. Once you've met your deductible, then you're just paying your copays, whatever your copays are, based on the tier of that prescription. And it's important, if I take multiple prescriptions, I want to look overall how the cost of my prescriptions are going to impact me from one plan to another. In one plan, my prescription might be a tier 3. On another one, it might be a tier 2, which can reduce a lot of my overall cost. So it's important to look at it, and formularies change every year. So it's really important you look at this every year. So as I'm paying my copays, depending on the tiers I'm in, if the retail price of my prescription ever totals $5,030, that's retail price. It's what I've paid and what the insurance company has paid. Then I go into this gap or this hole, right? There's a hole in my coverage. During that gap, I'm responsible for paying 25% of the cost of those prescriptions. So if I have a $10 prescription, I'm paying $2.50. I have a $1,000 prescription is $250. So it could get pretty expensive. And you stay in that gap until there's a new thing, a calculation. They call it a true out of pocket, although it's not a true number. It's a formula. If that number ever totals $8,000, then you go into what they call catastrophic. And new for 2024 is that if you hit catastrophic, you pay $0 for your prescriptions for the rest of the calendar year. I work with a lot of people day in and day out. Most people do not hit catastrophic, but for those that do, this is a really nice thing that after you hit that 8,000 catastrophic, you pay $0 for the rest of the calendar year. But what happens is then starting January 1st, things start all over again. So we talked about supplements, we talked about the drug plans. Now we're going to talk about a Medicare Advantage plan. So these are the Part C plans. Again, they're designed to cover your hospital, your A for hospital, your B for doctor, your D for drugs, all in one plan. Many plans are HMO type plans, meaning not only must the doctor accept Medicare, but they also must be in network with that plan. And there's also plans that are available that are PPO plans, where they say, yeah, we have a network of doctors. If you go to them, you're going to have a lower copay. But if you want to go outside of the network, you can. You just have higher copays, and you have to have the doctor has to be willing to accept you. And with some of those PPO plans, the doctor might tell you you prepay, and then you can get reimbursed. There's also something called Medicare Special Needs Plans. Those are for individuals that maybe are living in a nursing home or skilled nursing facility that have some type of low-income subsidy or have a chronic condition. So if you have a chronic condition, you can enroll in a plan specifically maybe for diabetics, where you would they would have extra benefits for you, or it's really honed in on diabetics. So in some states, they have plans that are available, so it's worth considering if you have a chronic condition. So when you're looking at a Medicare Advantage plan, there are a lot of plans. There's as many as 46 plans in any one specific service area. You know, when you're looking and doing your review, I recommend you do it in this order. One is look at your prescriptions and pharmacies and see who is going to have the lowest cost for you, right? You want to look at your cost. Then you want to say, okay, based on the lower cost plans, which one has all of my doctors in network? And don't forget about doctors that you see every 3 years. You know, I had a client who says, well, I had knee surgery 3 years ago. I'm never going to see him again. Well, guess what? He needed that surgeon again, and he wasn't in network. So it's very frustrating. So you want to make sure your doctors that are in network and doctors that you want to see. And then with a lot of these plans, they have a lot of extras. You know, they'll give you some dental, some vision, some hearing, and over-the-counter benefit. So there's a lot of extras that are part of these plans. So again, once you look at the prescriptions, once you look at the doctors, then you look at the extras and say, okay, which one makes the most sense for me? So looking at supplements versus an Advantage plan, you know, from a cost standpoint, the supplements are going to be a lot more expensive. Well, you're paying a premium because you're paying very little and you're out of pocket. With a Medicare Advantage plan, you're typically paying low to no premium, and then you have higher copays up to a maximum per calendar year. That's one of the nice things, is it caps out what your maximum out of pocket is. When you're looking at providers, with a supplement plan, it's easy. You ask your provider, do you accept Medicare? If they do, you can go. With an Advantage plan, you must say, do you accept XYZ Medicare Advantage plan? And then they can tell you if they accept it or not. So it just gets a little more complicated. With coverage with a supplement plan, it's only designed to cover medical, where the Advantage plan covers the medical, the prescriptions, and a lot of the little extra things, including an annual physical. Most people are surprised to find out the Medicare only covers a one-time Welcome to Medicare full physical, where an Advantage plan will cover physicals every year for you. So in looking at plans, what you want to look at is, what are the benefits? What's covered, what's not covered? Is my provider in the network? Are you willing to go to any hospital or any doctor? How does that come together? When we look at the cost, we're looking at premium, looking at co-insurance, co-payments, deductibles. maximum out of pocket. So if you're on a zero premium plan and your maximum out of pocket could be $7,000, are you comfortable with that? Would you rather pay a little bit higher premium and have a lower maximum out of pocket? These are the types of things to consider when you're doing the review of your plans. Again, prescriptions, you want to take a look at your prescriptions and you want to look at them every year. From year to year, the formularies change. So you want to understand how it works. Again, traveling, are you out of state part of the year? Do you have children in 3 different states that you go visit? You want to make sure you have networks of providers wherever you're going. Do you travel outside of the United States? Do you know how that works? How do you pull that together? Newer the last few years is something called a star rating. Every October, all the plans are given a star rating. So not only the insurance company, but each plan under the insurance company is giving a rating, and the ratings go from a number 1 to a number 5. Ideally, they want everyone to be a 5-star plan, but in order to get to a 5-star plan, it requires a lot of positive things to happen. Member surveys for that insurance company, the providers, all these things together give a score, 5 being the highest. And it helps you to really compare plans based on quality and performance and recognize that these ratings will change every October. Once you enroll in a plan, can you change your plan? Every year, there's something called an annual enrollment period that runs October 15th through December 7th, where if you enroll in the plan, you can make a change to your plan. If you want to keep your same plan, you don't have to do anything. It just automatically renews. But again, I do encourage you to look at the cost of your prescriptions and the different tiers on your plan versus other plans. You should, at the very least, look to see what options are there to help you choose the right plan for you. Do you stay with that plan or do you make changes to your plan? During that annual period, there is an opportunity for you to also make a switch from a Medicare Advantage plan to a Medicare Supplement plan. Please be careful. I highlighted this right here. The rules vary by state. Some states may require you to answer medical questions, and they can either say, sorry, we won't accept you, or charge you a higher premium based on how you answer those questions. So if you live one place and plan on retiring in another state, or you plan on staying where you are, you want to know what the rules are in those states so that you can make an informed decision. With Medicare Advantage plans, once you're enrolled, they do give you an opportunity, call it a Medicare open enrollment period, the first 3 months of the year. So it allows you to switch from one Medicare Advantage plan to another Medicare Advantage plan, or to go to your one Medicare Advantage plan to original Medicare with a prescription drug plan. But again, remember, you still have to apply for that supplement and you have to be accepted. If I move from one state to another state or one county to another county, I may need to change my plan. That must happen within 60 days of moving. And if there's a 5-star plan available in my state, I'm allowed to enroll in that plan at any time. I get a one-time opportunity to enroll in that plan. I gave you a lot of information today. For resources, Medicare is a wonderful resource. 1-800-Medicare is the phone number, so it's easy to remember also. You can go on there, you can ask them questions, medicare.gov. When I get a question that I'm not 100% comfortable answering, I'll go and do my research on there to help answer clients' questions. Social Security is another resource. So that phone number for Social Security is going to vary based on where you live. It could be a different phone number. And then Barnum, you're invited to this meeting by Barnum. We have resources here that can answer your questions. So that's the main phone number that rings to the Medicare department. That's our website. But you can give us a call and we'll be happy to answer your questions. Someone asked for a copy of my slides. I don't have everyone's email address. So if you send an email to the benefit, I think I have it here. Actually, you can just send it right to me. That's my email. If you send me an email, I'm happy to send out the slides to you. I also have a recording of today's seminar. If you prefer the recording, let me know and I'll be able to send that out to you. Are there any additional questions? I don't see any hands raised and looks like the chat is clean. Great. Well, thank you everyone for participating today. I really appreciate your time. I hope for those of you that are in the Northeast and you're getting all this snow that you guys are safe. But take care. Thank you, everyone. Bye-bye.
No, we'll start.